Happiness is not something ready-made. It comes from your own actions, Dalai Lama. Let's go now to Paget's disease of the breast. Paget disease of the nipple, also known as Paget disease of the breast, is a rare condition associated with breast cancer. It causes eczema-like changes to the skin of the nipple and the area of darker skin surrounding the nipple or areola. It's usually a sign of breast cancer in the tissue behind the nipple. This is the picture of a breast with Paget's disease. Causes. Two main theories have been proposed to explain the development of Paget disease of the breast. One theory suggests that distinctive cancer cells called Paget cells break off from an underlying tumor or malignancy within the breast and travel through the milk ducts to the nipples. The second theory suggests that the presence of and spread of Paget cells represents a distinct disease process originating in the outer skin layer of the nipple. The malignant changes occur without warning and for no reasons, or it spontaneously appear. As with other cancers, the exact underlying cause of or causes of malignancy associated with Paget's disease of the breast remain unknown. Researchers speculate that genetic and immunologic abnormalities, environmental factors, exposure to ultraviolet rays, certain chemicals, and ioning radiation, diet, stress, and other factors may play contributing roles in causing specific types of cancer. Diagnosis. Paget's disease of the breast is diagnosed based upon thorough clinical examination, identification of characteristic physical findings, a complete patient history, and a variety of specialized tests. Tests that may be used to diagnose Paget's disease of the breast include blood tests, surgical removal or biopsy, and microscopic examination of affected breast tissue, mammography or other specialized imaging of the breast, and/or microscopic evaluation of any nipple discharge for cancerous cells, cytologic smear. Standard therapies treatment. Treatment has traditionally included surgical removal of breast tissue, adjacent lymph nodes, and in some cases underlying muscles of the upper chest wall and other tissues, modified radical mastectomy. Sometimes, some individuals may only require a simple mastectomy, in which the breast and the lining over the chest walls are removed. Surgery is often the first type of treatment you'll receive. The two main types of surgery are mastectomy and breast-conserving surgery. Mastectomy surgery to remove the whole breast, which can be followed by reconstructive surgery to recreate the removed breast. Breast-conserving surgery, where the only cancerous lump or tumor and a little surrounding breast tissue are removed. Mastectomy. During a mastectomy, all your breast tissue, including your nipple, will be removed. You may need to have a mastectomy if the tumor is large or in the center of your breast. There's more than one area of breast cancer. Breast-conserving surgery will not provide acceptable results. If lymph nodes, small glands, are removed from your armpit during mastectomy, the scarring may block the filtering action of the lymph nodes, resulting in a condition called lymphedema. This is a long-term condition but can be treated with specialized massage techniques, compression sleeves, tightly fitting bandages that push excess fluid out of your arm, exercises, and skincare. Breast-conserving surgery. Breast-conserving surgery aims to save as much of your breast as possible while removing the cancer and a small amount of healthy tissue. If you have Paget's disease of the nipple, your nipple and areola will be removed. You should be offered reconstructive surgery to improve the appearance of your breast after surgery. If you have breast conserving surgery, the amount of breast tissue removed will depend on the size of the tumor in relation to the size of your breast, whether the tumor is in one place or scattered throughout your breast. Your surgeon will remove some healthy breast tissue around the cancer so it can be tested for traces of cancer. If cancer cells are found in your surrounding tissue, more tissues may need to be removed from your breast. After having breast conserving surgery, it's likely you'll need to have radiotherapy to destroy any remaining cancer cells. Breast reconstruction. If you have a mastectomy, you may be able to have reconstructive surgery to recreate your breast. This can be done by inserting a breast implant using tissue from another part of your body to create a new breast. The reconstruction can be carried out at the same time as your mastectomy or at a later stage. It may be possible to have reconstructive surgery after breast conserving surgery to improve the appearance of your breast and create a nipple. A nipple can be created by having a nipple tattooed onto the skin or using your own body tissue such as tissue from your other nipple, although around half of this flatten out and shrink over time, or using a stick-on latex rubber nipple which can be made from a mold of your other nipple so that they are identical. You stick on it every day with glue and it can be removed from washing. Prosthesis. If you decide to have breast reconstruction, you can wear a false breast or breast prosthesis which is available free on the NHS. After having a mastectomy, you may have a temporary fiber-filled prosthesis and a permanent prosthesis made from silicone which can be replaced every 2 years. If you have non-invasive breast cancer where the breast cancers are contained in one area of your breast, surgery may be the only treatment you need. After surgery, you may need further treatment if you have invasive cancer, where the cancerous cells have spread into other tissues in your breast. Other types of treatment for breast cancer include chemotherapy, radiotherapy. Chemotherapy, where powerful medicine is used to destroy cancer cells and prevent them from dividing and growing. Radiotherapy, where controlled doses of high-energy radiation, usually X-rays, are used to destroy cancer cells. Targeted therapy and hormone therapy are also used. Targeted therapy, if you have breast cancer in HER2-positive targeted therapy, usually a medicine called trastuzumab, can be used to treat the cancer by stopping the effects of HER2 and helping your immune system fight off cancer cells. Hormone therapy, if your breast cancer is hormone-receptor positive, hormone therapy can be used to treat cancer by lowering the levels of hormones in your body or stopping their effects. The therapeutic management of individuals with Paget's disease of the breast may require the coordinated efforts of a team of medical professionals, such as physicians who specialize in diagnosis and treatment of cancer, medical oncologists, specialists in the use of radiation to treat cancer, also radiation oncologists, surgeons, oncology nurses, and other healthcare professionals. Specific therapeutic procedures and interventions may vary, depending upon the numerous factors such as extent of the primary tumor or the stage, the degree of malignancy or the grade, the nature, size, and invasiveness of underlying breast malignancy, and the presence or absence of metastatic disease, individual age, and general health, and other elements. Decisions concerning the use of particular intervention should be made by the physicians and other members of the healthcare team. If careful consultation with the patient based upon the specific of his or her case, a thorough discussion of the potential benefits and risks, patient preference, and other factors. In selected cases where there is no palpable breast mass and negative mammograms, or in those with disease confined to the nipple and areola, conservative tissue-sparing surgery or lumpectomy may be recommended. Paget's disease of the breast has a prognosis that is intimately tied with the underlying ductal cancer. The underlying ductal cancers often have poor prognostic features than typical often screen-detected breast cancers, including high-grade, large size, and negative hormone receptors expression, loss of estrogen and progesterone receptors. However, Paget's presentation does not make the prognosis any worse than any underlying malignancy's prognosis. Investigational therapies at present, there is what you call photodynamic therapy, PDT. A procedure in which a drug known as a photosynthesizer is used along with a specific type light. Has been used to treat some individuals with extramammary Paget's disease and a rare cases of Paget's disease of the breast. During photodynamic therapy, the drug is administered to an affected individual and absorbed by the affected cells. Is Paget's disease of the breast fatal? The prognosis of Paget's depends on the presence of invasive cancer and axillary lymph node spread. In Paget's disease, there is no underlying breast malignancy or no lymph node spread, and 5 years survival is 92 to 94%. How aggressive is Paget's disease of the breast? As a non-invasive form of cancer, Paget's is not considered an aggressive or fast-moving disease, but is often associated with another cancer in the same breast. What is the survival rate for Paget's disease of the breast? For women with both Paget's disease of the breast and invasive cancer in the same breast, the 5-year survival rate declined with increasing stage of the cancer. Stage 1, 95.8%, Stage 2, 77%, Stage 3, 46.3%, and Stage 4, 14.3%. Will a mammogram show Paget's disease? Usually, the Paget's is referred for imaging after biopsy from the lesion, and this confirms the diagnosis of Paget's disease. Mammography is the initial radiologic investigation for detecting underlying invasive carcinomas or DCIS. However, it may be normal and ultrasound is performed when the mammogram is negative. How does Paget's disease of the breast start? Doctors don't know what causes Paget's disease of the breast. The most widely accepted theory is that the disease results from an underlying ductal breast cancer. The cancer cells from the original tumor then travel through the milk ducts to the nipple and surround its surrounding skin. Is Paget's disease always cancer? Paget's disease is a malignant rash of the skin of the nipple or areola. It is a rare condition accounting for only 1% of breast cancer. Paget's disease may be associated with ductal carcinoma in situ or invasive cancer deeper in the breast. How can you tell the difference between Paget's disease and eczema? Paget's disease can look like other skin conditions such as eczema or psoriasis, but there are differences. For example, Paget's disease affects the nipple from the start, while eczema generally affects the areola and only rarely affects the nipple. How can you prevent Paget's disease of the breast? Can Paget's disease of the breast be prevented? Yes, exercise regularly, eat healthy foods, maintain a healthy weight, limit alcohol consumption, have a regular breast checks and mammogram for early detection to prevent the spread of the disease. Possible signs and symptoms of Paget's disease of breast include flaky or scaly skin on your nipple, crusty or oozing or hardening skin resembling eczema on the nipple, areola, or both, itching, redness. Additional signs and symptoms: a tingling or burning sensation on your nipple area, straw-colored or blue bloody nipple discharge, a flattened or turned in inverted nipple, a lump in the breast, thickening of the skin on the breast, increased breast sensitivity, soreness, and pain. Signs and symptoms usually occur in one breast only. The disease typically starts in the nipple and may spread to the areola and other areas of the breast. The skin changes may come and go early on, or respond to topical treatment, making it appear as if your skin is healing. On average, women experience signs and symptoms for several months before getting a diagnosis. When to see a doctor? Be aware of any changes in your breast. If you feel a lump in your breast or if you experience itching or skin irritation, that persists for more than a month, make an appointment with your doctor. When to see a doctor? If you're being treated for a skin injury on your breast and the condition doesn't go away with treatment, make follow-up appointment with your doctor. You may need a biopsy, a procedure that collects a small tissue sample of microscopic analysis to evaluate the affected area. Risk factors. Risk factors that affect your likelihood of developing Paget's disease of the breast are the same factors that affect your risk of developing any other type of breast cancer. Risk factors such as AIDS, a personal history of breast cancer, a personal history of breast abnormalities, family history. AIDS, your chances of developing breast cancer increase as you get older. A personal history of breast cancer. If you have a breast cancer in one breast, you have an increased risk of developing cancer in the other breast. A personal history of breast abnormalities. If you have had lobular carcinoma in situ or atypical hyperplasia, your risk of developing breast cancer is higher. Certain benign breast conditions are also associated with a slightly increased risk. Family history: if you have a mother, sister, or daughter with breast or ovarian cancer or both, or even a father or brother with breast cancer, you have a greater chance of developing breast cancer. An inherited gene mutation that increases the risk of breast cancer. Dense breast tissue, radiation exposure, excess weight can also are considered risk factors. An inherited gene mutation that increases the risk of breast cancers, defects in one of several genes, especially BRCA1, BRCA2, but put you to at greater risk of developing breast cancer, as well as ovarian and other cancers. Such defects account for fewer than 1 out of 10 breast cancers. Dense breast tissues. Women with dense breast tissues, as seen on mammogram, face a higher risk of breast cancer. Radiation exposure. If you receive a radiation treatment to your chest as a child or young adult to treat another cancer, you're more likely to develop breast cancer later in life. Excess weight. Weight more than is healthy for your age, and height increases your risk of breast cancer, especially after menopause and if you gain weight as an adult. Other risk factors: hormone replacement, race, and alcohol. Hormone replacement. Taking estrogen after menopause increases the risk of breast cancer for some women. Race: white women are more likely to develop breast cancer than black or Hispanic women, but black women are more likely to die of the disease. Alcohol: drinking large amount of alcohol increases the risk of developing breast cancer. Having one or more risk factors doesn't necessarily mean you'll develop breast cancer. Most women with breast cancers have no known risk factors. Prevention: making changes in your life daily may help reduce your risk of breast cancer. Ask your doctor about breast cancer screening. Discuss with your doctor when to begin breast cancer screening exams and tests such as clinical breast exams and mammogram. Talk to your doctors about the benefits and risks of screening. Together, you can decide what breast cancer screening strategies are right for you. Become familiar with your breast through breast self-exam for breast awareness. Women may choose to become familiar with their breast by occasionally inspecting their breast during a breast self-exam for breast awareness. If there is a new change, lumps, or other unusual signs in your breast, talk to your doctor promptly. Breast awareness can prevent cancer, but it may help you to better understand the normal changes that your breasts undergo and identify any unusual signs and symptoms. Drink alcohol in moderation, if at all. Limit the amount of alcohol you drink to no more than 1 drink a day if you choose to drink. Exercise most days of the week. Aim for at least 30 minutes of exercise on most days of the week. If you haven't been actively lately, ask your doctor whether it's okay and start slowly. Limit menopausal hormones therapy. Combination hormone therapy may increase the risk of breast cancer. Talk with your doctor about the benefits and risks of hormone therapy. Some women experience bothersome signs and symptoms during menopause, and for these women, the increased risk of breast cancer may be acceptable in order to relieve menopause signs and symptoms. To reduce the risk of breast cancer, use the lowest dose of the hormone therapy, possibly for the shortest amount of time. Maintain a healthy weight. If your weight is healthy, work to maintain that weight. If you need to lose weight, ask your doctor about healthy strategies to accomplish this. Reduce the number of calories you eat each day and slowly increase the amount of exercise. Choose a healthy diet. Women who eat a Mediterranean diet supplemented with extra virgin olive oil and mixed nuts may have a reduced risk of breast cancer. The Mediterranean diet focuses mostly on plant-based foods such as fruits and vegetables, whole grains, legumes, and nuts. People who follow the Mediterranean diet choose healthy fats such as olive oil over butter and fish instead of red meat. The key to being happy is knowing you have the power to choose what to accept and what to let go. Dudinsky. Research done by Dr. Ray J. Libakin. Please subscribe to my channel and click the notification bell to further hear about breast lectures. Thank you.